This is what happens in pregnant women, but many people don't know. But I'm going to explain it for you so that you understand it better and care for yourself and your baby that you are carrying. You see, in this type 3 diabetes, that is the gestational diabetes, it is mainly affects pregnant women. So my gender, come close, pay attention. Not only my gender, hubby too can listen and educate the wife. You too can listen and educate your wife. Thank you. So I want to talk about gestational diabetes. That is the type 3 diabetes. My previous video, I explained everything about type 1, type 2. In this one, I'm going to explain in full detail about this gestational diabetes, because if you don't manage it well, it will affect both the pregnant woman and the baby that she's carrying. So you have to pay attention on this particular type of diabetes, so you can save your life and to save the life of your baby that you're carrying. So this type of diabetes happens in pregnant women, even if they have never had diabetes before. But it is very important to understand it for the health of the mother and the baby. So a gestational diabetes is when the pregnant woman's blood sugar becomes too high during pregnancy. Do you get it? So listen, let me explain it better to you in a way that you understand it, like in a simple and easiest way that you can remember. This type of diabetes usually happens around 24 to 28 weeks of pregnancy. But if it is not well managed, it can harm the mother and the baby. Now you may ask, what causes the high sugar in pregnancy? So listen to me, I will explain. Okay, it is the work of pregnancy hormones made by the placenta. That's the placenta. Okay, the organ that feeds and protects the baby. These hormones are important for the baby's growth, but they can also block the insulin in the mother's body. What are those hormones? Let me mention them to you and explain how they affect the pregnant woman. Number one is human placenta lactogen, HPL. This hormone works like it helps to prepare the mother's body to give nutrients to the baby. You see, but it can block the insulin of the mother. Too much of everything is bad. So number two is estrogen. This particular hormone helps the uterus to grow, increases blood flow to the baby. As a pregnant woman, how big is the uterus? This at the first trimester is how it will be at the second and third trimester. You get it? Is this estrogen that is increasing the uterus, so that the baby too that is increasing will see space and the blood will circulate very well, and the baby's blood will circulate very well. Or other chico like this, ebe nwata nọ na ma nwere ka o si megara arụ just kiche echiko, it will affect the baby. Is this particular hormone that is helping the uterus to grow. Okay, so the other one is cortisol, which is called stress hormone. Some people will be like, stress hormone. It doesn't mean that it causes emotional stress. No, it doesn't cause emotional stress. It means that this hormone is being released whenever the pregnant woman is in physical, emotional stress. Do you get? During pregnancy, a lot of things are going on inside our body. So it's this hormone that when your body releases this hormone, it will go and help out. Whenever you are in too much stress, your body will release this hormone so that it will not affect the baby, to continue protecting the baby, preparing the baby's life after birth, getting the lungs ready, even to breathe. Is this stress hormone, cortisol, that is responsible for that. So when this cortisol is too much in your body, it will affect your insulin. You see, all these hormones that I just mentioned is very good for the baby, but they make it harder for insulin to do its work. And once the insulin cannot do its work properly, you know what's next? Sugar will stay in the blood. That is why the mother's blood sugar goes high during pregnancy. Do you get it? Because those hormones are high. Who is at risk? Let me tell you, women who are overweight before getting pregnant. Another one is women who had gestational diabetes before. Like their first issue, they had the gestational diabetes. So they have the chance again to have gestational diabetes again at their second issue. You get it? Women with family history. Women with family history. You watch my previous video, you understand the family history I'm talking about. Women who had baby before that weighed 4 kg or more, they are likely to be at risk. Yes, and also women above 35 years, like do category 35 years, that marry me. Do you get? Now, signs and symptoms. I've mentioned the signs and symptoms and explained all in details in my previous video. So go and watch my previous video, you will see it. I'll just mention them. Blur vision, thirsty, urinating too often, tiredness, etc. Please do me well and watch that video where I explained it better. You see, this is why it is very important for all the pregnant women to go for antenatal checkup so that the doctor will check for their sugar level at 24 to 28 weeks of pregnancy. So let me talk about the dangers to mother and baby. If this sugar problem is not well managed, it can lead to this preeclampsia, that is like baby's weight, compress your veins, so blood cannot penetrate. But that one, if you lie down and get adequate rest, it will go off. But this one I'm talking about is Ikpebi. Is it Ikpebi or what? I've forgotten. So their legs will be like, do you get it? Another one is it can lead to CS, and the mother will be at high chance of getting the type 2 diabetes. If you watch my previous video, I explained everything for that type 2 diabetes. So if you're watching my videos, you have to start from beginning so that you'll be following the video. That when I mention something, you will get it because you have watched the previous video, so you'll be following. Okay? So the danger sign for the baby is, number one is macrosomia, too much weight. The baby will be too fat, too much weight. That is macrosomia. It's not like ordinary, now. This one is exceptional weight. Too much weight. The next one is low blood sugar after birth, because the baby is taking the sugar during pregnancy. That one that the insulin couldn't pass to the cells. So the baby is taking it from your blood. After birth, now the baby will not see the sugar again. The baby will now depend only on the one that the baby's body produces. Do you get it? Not like when the baby was in the womb, taking the sugar from the mom. Now that the baby is outside, the baby can't find the sugar again. So the baby now depends on the one that the baby's body produce. Do you get it? So the ones that the baby's body is producing is no longer enough for the baby. Do you get it? So it's no longer enough for the baby, resulting to low blood sugar after birth. I hope you get it right. So another dangerous one is, in some cases, it can result to stillbirth. Yes, in some cases, it can lead to stillbirth. That is, the baby will fight. The baby is fighting that high sugar level in the uterus. Do you get it? And the baby insulin gets tired, and the baby will die inside the womb. Couldn't make it. That is why we have to be careful about this. After watching this video, I know you will not fall into victim. So how can we manage this thing? How can we manage this gestational diabetes? The good news is this. We can manage gestational diabetes. So let me tell you now. Healthy eating. Eat more of vegetable, whole grain. Drink more water instead of sugary drinks. Do you get it? Yes. Eat fruits. Walk around. Yes. Go for medical checkup. Your antenatal. Walk around like 20 to 30 minutes. Do little exercise. Take medications if needed. so that you can prevent this, so you can manage it. And after delivery, the sugar level normally go down because the baby that is in the womb that is making your body to produce those hormones is no longer producing the hormones. So it will go down. But the mother still have the higher risk of developing the type 2 diabetes. Your baby may grow up with obesity, yes, diabetes. So stay healthy, eat healthy meal, stay active, go for sugar checkup. Please teach your child the healthy habit. So my sister, aunties, and mothers, gestational diabetes is real, but thank God you can control it. So go for your antenatal care, stay active, eat healthy. If the doctor gives you medicine, take it all. Yes, some people will be like, I don't like the scent of this medicine. Oh, you will keep it. You don't know there is a reason why your doctor gave you that medicine. Yes, let us protect both the mother and the child. Please share this message with other women and family. Follow this page for more health education in simple language. Thank you so much, and God bless you and your baby.